Okay. Our topic this month is heart disease. And if you could introduce yourself.
I'm Dr. Alan Taylor, private practitioner here in Mansfield, Texas.
Okay. And you work at Methodist?
I work at Methodist Mansfield as well as Medical Center of Arlington.
Okay, excellent. So heart disease is a huge topic. So let's just kind of take it broad and then narrow it down just a little bit. I have some questions for you, which I'm sure you're going to be able to answer.
Hopefully.
There are a variety of different types of heart disease. What are the different types?
The number one most common type of heart disease is called coronary artery disease, where the arteries of the heart get blockages in them, causing reduced blood flow. And that causes angina, which is chest pain with exertion. It causes sudden cardiac death, where someone drops dead from exertion or just drops dead. It is the most common cause of heart disease. It is also probably the most preventable cause of heart disease. The scope of how it affects the American population, 53% of us will die from heart disease, and that's 53% of men as well as 53% of women.
Wow.
The hallmark of preventing heart disease is going to be diet and exercise. The less fat that you can get in your diet, the better off you are. And 30 minutes of continuous exercise every day is absolutely essential for the prevention of heart disease.
Okay. Now you say less fat. Is there good fat, bad fat?
Generally speaking, animal fat is bad for you. Plant fat is good for you.
Okay.
We do need a little bit of animal fat for basic metabolism, but after that we don't need what we're getting.
Okay. The other thing that I was reading the other day, that January is the peak month for heart attacks. Why is that?
Probably the stress over the Christmas holidays and Thanksgiving holidays, as well as the overeating over the Christmas and Thanksgiving holidays. And then we're sedentary because of the winter months.
Yeah.
I'm from the north, so I'm not sure we have winter down here.
Yeah.
And then we start doing activity, and that's bad not to do activity, then all of a sudden do a whole bunch of activity. You should be doing activity every day.
Okay. I also read that heart disease is on the rise, and they say that it's going to increase like 45% by the year 2030. Why is that? Why is it so prevalent and increasing so much?
If you look at just the general population, my parents who had heart disease in their 40s, 50s, and 60s, and 70s, and 80s worked very hard for a living, and yet they ate horrible. I grew up with beef in the house for every meal. My generation, when we were kids, we played hard every day, but we still ate bad. My children's generation, which are now in their 20s, didn't exercise as much as we should, and they also ate horrible.
So exercise sounds to be the key, and when you say exercise, like how much exercise? What are you talking about?
I'm not in favor of joining the gym and working out there. What I'm looking for is 30 minutes of continuous exercise every day. Walking is the one that I recommend to most of my patients, because almost all of my patients can walk.
Yeah.
You can walk here in Texas probably 360 days of the year. If you can't walk outside, you can walk in the malls, you can walk in the big department stores, Lowe's, Home Depot, anything that you can just walk. If you can't walk, then a stationary bicycle, a rowing machine, anything that you can do continuous exercise. I have a lot of patients with bad knees, bad hips, and I recommend an ergometer, which is a little pedal machine that you can buy for $25, $30. You put it in front of you watching TV, and you just sit there and pedal for 30 minutes. I'm not talking about running the Boston Marathon. Most of my patients will never make the Boston Marathon, but if they just do something continuous for 30 minutes every day, that'll do them a huge amount of good.
Okay. And diet. I know you and I've talked about this before, about just the education of how someone should eat.
The three diets that I'll talk about very quickly is the Texas diet, which is not that good of a diet. We all know what it is. With that diet, 53% of us are going to die from heart disease, and probably 99 to 100% of us have some type of vascular disease. The American Heart Association diet is recommended by the American Heart Association, by the American College of Cardiology, and that limits the amount of animal fat you get, and that is going to reduce the chances of developing heart disease. The vegetarian diet, which is an extremely hard diet, especially here in Texas, where you eat nothing from animal, has been proven in a number of studies to reverse heart disease.
Really?
But once again, that's a radical diet for the average American.
Okay. So animal fat is the key then?
Animal fat and exercise.
Okay. Okay. Very good.
It's that easy.
It's that easy? Well, it's easy to say that.
Oh, absolutely.
Yeah, yeah. Now, I also understand that Methodist is doing this Run with Heart. Can you tell us about that?
Yeah, Methodist Mansfield sponsors Run with Heart. This year it's going to be January 27th. There's a 1 mile walk, a 5K run, and for those who want, there's a half marathon that wanders itself through Mansfield, as well as activities before and after the walk and the marathon. And then you also have a chance to see the Methodist Mansfield campus. And what I'm proud of here is that there is a walking trail all the way around the hospital. You can make it as long as short as you want by cutting in the different sidewalks. And it's a nice place because it's very well lit 24 hours a day. There's security here, and you're also close to the hospital if something happens.
Okay. Very good. Thank you very much.
Thank you.